Group 4, Cases 1 and 40. Case 1 deals with a toddler named Anne who has been diagnosed with autism spectrum disorder. ASD is a neurodevelopmental disorder that impairs a child's communicative, social, and emotional functions. Children with ASD also display certain characteristic behaviors such as repetitive body movements, fascination with unusual objects, and extreme preoccupation with a specific area of interest. Autism is most commonly diagnosed in young children who are initially referred for significant developmental delays. At 11 months, Anne's pediatrician referred her to a university-based speech, language, and hearing clinic due to his concern with her delay in reaching developmental milestones. Aside from the occurrence of multiple ear infections, which were later corrected with the use of pressure equalization ear tubes, Anne has an insignificant medical history. At approximately 16 months, Anne's mother became concerned with her apparent lack of motor abilities and communication skills and brought her in for evaluation. Anne's testing concluded that her skills in the area of speech, language, social interaction, and attention were below normal limits. It was additionally noted that she had low muscle tone and was lacking in developmentally appropriate play skills, was unable to express her needs and wants, lacked joint attention and social skills, and displayed behaviors that are characteristic of ASD.
At 1 year, 9 months, Anne began therapy and a treatment plan. This was developed to address her deficits in receptive and expressive language skills. Following the results of several diagnostic therapy sessions, modifications were made to Anne's treatment goals to address certain behavioral issues that had been interfering with the effectiveness of therapy. Tactile stimulation was utilized to assist Anne in her transition into the therapy room. Modifications of the physical environment ultimately reduced the incidence of problem behaviors. Anne's ultimate treatment goals included participation in play activities without exhibiting inappropriate behaviors, choosing a preferred object among a field of 2, and making requests for desired items. After 2.5 months of therapy, Anne showed significant improvement in all 3 goal areas, and she had achieved 90% accuracy in all 3 of her therapy objectives. Additionally, Anne has begun to spontaneously produce some meaningful single-word utterances such as no and ball. Anne's future therapy goals include focusing on improving her ability to take turns during play-based activities, make requests, and use picture communication exchange system to facilitate daily communication tasks.
Case 40. This case is about Patricia, a 45-year-old woman who has developed severe Wernicke's aphasia due to an underlying malignancy. The term aphasia describes a neurogenic condition that impairs a person's ability to produce and/or comprehend speech. Aphasia is caused by damage to the brain, typically resulting from a stroke. The area of lesion is directly related to the classification of the disorder and specific areas of speech that are affected. The 2 types of aphasia that are discussed in this case are Wernicke's and conduction aphasia. Both are classified as fluent type aphasias caused by lesions in the posterior region of the left cerebral cortex. In addition, they typically impair receptive abilities, such as auditory and reading comprehension. Furthermore, Wernicke's aphasia is characterized by difficulties with verbal repetition, poor attention, and lack of symptom awareness. The strokes that Patricia suffered severely impaired her communicative abilities. During a language evaluation, Patricia demonstrated severely impaired auditory comprehension. Although she displayed good nonverbal pragmatic skills and could occasionally generate meaningful utterances using small words or short phrases, she was unable to demonstrate this regularly and in response to stimuli. Furthermore, Patricia was unable to communicate through writing, but was occasionally able to communicate using gestures and phrases.
Prior to treatment, Patricia was administered the Bedside Evaluation Screening Test Second Edition, a standardized language screening that assesses language in the areas of speech, reading, and comprehension. The initial test results indicated that Patricia exhibited a moderately severe fluent aphasia with deficits in all language modalities. The evaluation also indicated an impairment in both her auditory comprehension and verbal repetition. Patricia's treatment plan included focusing on improving her gestural communication, verbal expression, and auditory and verbal comprehension. When she began therapy, Patricia's sessions consisted of role-playing in functional situations, use of gestural communication, answering yes-no questions, and participating in various reading exercises. Following 7 months of therapy, Patricia was re-administered the BEST 2, resulting in an unchanged score. She did, however, show improvement in her functional language skills. The case concludes with a recommendation of continuing to facilitate communication in real-life situations and emphasizes the importance of encouraging active participation of family members in the treatment process.